Hey, open enrollment is nearly upon us, and since I spend so much time explaining to people every day at work about their insurance and how it works and trying to help them afford their medications, I thought that I would make a quick PSA, so to speak, to try to see if I can help anybody make better decisions this year, or at least understand how their plans work so they can plan better. One thing that we all are trying to do when we pick out our plans is to find the most affordable plan. But sometimes when calculating the costs, we look at the monthly cost of the premiums, but we don't see if we can actually afford to use the insurance if we do get sick or need anything. And I talk to patients every day who have plans that they really can't afford to use. For instance, you might have a deductible that may keep the premium low, but when it comes time to actually get a medication or have a procedure or a test, it may be too expensive then for you to do that, or you think about not doing it or doing without. And I have patients who are rationing their medications all the time because of that. So ask yourself, for instance, if you have a $480 deductible on your prescriptions, and the first time you are prescribed an inhaler or any other brand medication that is likely to be $400 or $500 minimum, would you go without? Because you'd have to pay all that up front the first time. Maybe after that your copay might only be $20 or something else that's really affordable, but that first time, is that going to keep you from doing it? And that happens a lot with most of the Medicare D plans that I'm aware of have a $480 deductible, or at least many of them do. And so that's one of the things you want to plan ahead. If you're going to have a deductible like that, then you want to set aside that much money so that you can get something the very first time. Otherwise, you can't afford to use your insurance, and you might as well not even be paying anything for your insurance if you can't afford to use it. We all want to get the best coverage that we can get, that we can afford to get. And if you're getting Medicare, one of the things I'd like to point out is your best coverage, if you can afford it, is to get the regular Medicare A, Medicare B, the traditional, your red, white, and blue card, plus a Medigap plan or a supplement that will pick up most of your co-insurance and might pick up your deductibles as well, and then a separate Part D plan, and then you have to pick out a Part D plan that's going to be good for you. An Advantage plan may be a lot cheaper up front, and it may look like it covers a lot more stuff. It's like it might cover your dental or vision or something like that. But keep in mind that, first of all, if you get an Advantage plan, you can't use a Medigap plan with that. So you can't have a supplement that picks up your co-insurance, and your co-insurance may actually be very high. And so if you end up in the hospital or needing lots of procedures or things, then as you get sicker, as you age especially, your out-of-pocket expenses can be a whole lot more with an Advantage plan. And one thing to think about is that if you forego that supplement up front because you've gotten an Advantage plan, you may not be able to get one later on when you think you need it, because they can turn you down for existing conditions, pre-existing conditions, if you don't get it when you first get Medicare. Which is something that we should talk to Congress about, but that's a whole other thing. The other thing with Advantage plans that you might not think about is that you may be limited as to which providers you can go see, and you will need authorizations for almost anything that you have done. So if you have to get a test or a surgery or anything like that, your care may be delayed while you're getting it approved. And they can tell you where you have to go to have it done, and they can deny you. So with traditional Medicare, providers pretty much know what isn't covered, and with these Advantage plans, they can just say no sometimes. And so that's just something to think about. Obviously, you get what you can afford, and so you go and get the best care that you can afford to get right now. But if you have any questions about how any of this works, I might be able to answer you in the comments or make another video. I'm not an expert. I haven't studied this. I just have been working with this for about a decade, and especially with the prescription side. So if you have any questions, feel free to drop me a message.